Right, so our next speaker is Jenny Allison. Jenny Allison is the Regional Lead Psychologist for the Cancer Psychological and Social Support Initiative. She works for Auckland District Health Board, managing the Cancer Support Team, which is a team of psychologists and social workers who work with the patients who are recently diagnosed and receiving treatment for cancer. Thank you so much for coming in today, Jenny.
Thanks, Emma. Hi, gosh, I feel like I nearly can't see over this. Sorry to the people over there who can only barely see the top of my head. Is that okay? So, thank you. Yes, I'm Jenny Allison. I'm the Regional Lead Psychologist for the Northern Region. So that means my team covers, I've got kind of 4 teams in my bigger team, and they cover the Auckland region and Northland. But I'm part of an initiative that crosses the whole country. I might get to talk about that a little bit later. So I'm a health psychologist. So although that's my official title, my background is health psychology. And that means that I'm a psychologist that is specially trained in helping people cope with physical health conditions. And when I was putting together this talk, I used information that I had from the literature that is around about coping with neuroendocrine tumours and cancer and communicating. But also, I think I want to acknowledge the many, many patients that I've seen. So I've been working as a psychologist for about 15 years. And I guess the information that I get from them and the stories that I hear from them is the really rich information that I learn from. And I guess I want to also acknowledge the expertise in this room because you are really the experts in all of this. And I think that you probably are much more expert than me in neuroendocrine tumours, but also in probably coping with cancer and communicating with people with cancer. And so I will be talking about some ideas and some tips and things that I have heard from patients. But I guess I want you to take that, not with a grain of salt, but take it with your own eyes and work out what's helpful for you and what fits with how you work and how you're coping with things. And I guess I also want to say that also within this group there is many different experiences. So people come with very different things to this room. So I guess I just also want to acknowledge that. Okay, so when Siobhan asked me to talk today, she asked me to talk about communication and talking about neuroendocrine tumours or talking about cancer. And I think that this was in response to her having lots of questions from patients about how do I talk about what's happening, what do I say, who do I tell, how do I manage this situation. And so that's kind of where then I came along. And we know that communication can be quite tricky. It kind of sounds like an easy thing to do, but it's actually not that easy at all. And we know from a study, a very large study actually that was done all over the world in coping with neuroendocrine tumours, that about 1/3 or just over 1/3 of people report that they have changes in their relationships with partners, friends and family. And we know that probably a big part of that is communication as well. And it's definitely a theme that comes up for people when I'm seeing them. So unfortunately, the bad news is that I don't have a magic set of answers. There's not something that I can kind of give you and say, this is what you need to do, and talking about your situation is all of a sudden going to be easy. That list of things doesn't exist really, because as I said before, everybody is quite different. I think though that there are probably some tips that are helpful, and so I guess that's what I'm going to talk through now. So one of the things is that what's really important actually is just to sit back and have a think about what works for you and what is right for you. So some people are very public people and they're very open about things. Other people are very private. That's how we work. We're all different. And so in order to work out your best type of communication and who you want to tell and how you want to do that, you actually have to sit back and have a think about actually what's going to work for you. And what that means is you can't look at the person who's sitting next to you and think, well, they did it that way, so that's probably going to work for me too. How someone else does it doesn't mean that's how you have to do it. So having a think about that. Sounds easy, again, but I'm not sure how often we do it. What I would say, though, is that communication also often means support. So if people don't know what is happening with us and they don't know what we need, then we often don't get the support that we need. And so talking with people and communicating clearly about how we are and what we need can mean that we get helpful support. So that's important. The other thing I would say is that when you're thinking about communicating with people about what's happening, it might be about diagnosis or it might be about how you're coping with treatment. So some kind of potentially difficult conversation, it can be helpful to plan. So it can be helpful to have a think about what you want to say and how you want to say it. It might even be that you write it in a letter. The planning might go that far. So planning is quite helpful. It can be helpful to plan a good time to do it and make sure that there's no distractions. So planning's helpful, but sometimes you just have to take the moment. And I've got a little story that happened to me within the last couple of weeks that when I was planning this just kind of came to my mind. And it was an example of taking the moment. So I have a 9-year-old son, and he is at school at the moment, not literally at the moment, but at school. And at the moment he's going through puberty talks once a week. He's very excited about them because he gets to go to a special room and there's comfortable chairs. And for about the last year, probably, my husband and I have been saying, we need to sit down and have a few chats. My husband has actually been thinking he was going to do it. And it's been all quite, it's been on our mind for a long time. We need to start talking to Lewis about some of the birds and the bees type stuff. And so we were in the car the other day on our way to Lewis's drama class. And he said to me, with the background obviously of having had these puberty talks, that he said to me, Mum, do people decide to have babies or do they just come? Do you plan them? So I thought, that's my opportunity. Here we are, we're in the car, it's just me and him, and I had a bit of a chat about the birds and the bees at that moment. So I guess what I'm saying is that planning can be helpful, but sometimes you take a moment. And that for me was a moment of a conversation I've been meaning to have, and it just felt perfect. Everything fitted into place, and it went really well. So sometimes you take the moment, and that also works. The other thing is that it can be helpful to let people know when you want to talk about things. So this is probably going to come up a little bit later in my talk as well. And I'm not talking now so much about needing to have a kind of serious conversation. I'm talking about the day-to-day type of things, when you might be meeting up with a friend and they might be asking how you're doing and they're asking about what's happening with treatment. There might be days when you really don't feel like talking about it, and it's actually okay to say, well, look, do you mind if we don't talk about it today? Can I hear about how things are for you? Or, can we just go and have a cup of tea or watch a movie or whatever it is? We often hear that sometimes people, they don't know what they don't know what to say and they don't know what to do, and so it can kind of start to feel a bit awkward. So sometimes you have to guide people in that. And my last, sorry the list isn't longer, but my last tip, not the end of my talk, but my last tip is that it can be really helpful to use resources. So if you're having those conversations about what's going on, and you don't really know how to do it, it can be really good to use books and resources. So I'm quite aware of some of the resources that are available through the Unicorn Foundation. And I think that's probably in New Zealand, but also probably internationally. And if it can be helpful to sit down with one of the booklets and talk that through with someone rather than having to do it all yourself. Equally, health professionals can be quite useful. So if you need to have a conversation about something that's going on and you don't know how to do that, you can bring in a health professional, maybe come with someone like a nurse specialist and ask them to kind of help and guide you through things as well. Have the conversation with them. Okay, so that's my communication 101. But what I often see is that people come across speed bumps along the way. So these are the standard speed bumps that I see people come across. As I said before, just remember, take the stuff that works for you and the stuff that doesn't fit, just leave behind. So the first thing that I often see is that these are two things that people struggle with. So other people's advice giving and stories. And I see a few nods in the room, so I think it might be something that people can identify with. So first of all, I guess stories. It seems to me that a common reaction when you're talking about cancer or neuroendocrine tumours is that people often have another story. A story about their own cancer, or often not their own cancer, but often a relative's cancer or a friend's cancer or someone distant that they knew. I think particularly in this group of people with neuroendocrine tumours, that's particularly difficult because often the story won't be about a neuroendocrine tumour, often it'll be about some other type of cancer, which can feel like it really doesn't relate. And because everybody's experience is different and everybody's cancer is different, having someone else's story can feel quite unvalidating and a little bit frustrating. So that's something that people often struggle with. The other thing is advice giving. So although well-meaning, people often like to give advice about things. It can be anything, can't it? It can be about diet or exercise or when you should sleep or how you should walk or what treatment you should do. There's so much advice that people have. And although well-meaning, as I say, because often it really is, it can feel frustrating and it can feel quite confusing for people. So what do you do about those things? And I guess that's where we come back to, you have to kind of work out what's right for you because there's many kinds of reactions to that. One of the things I think is to acknowledge that lots of people find those things difficult. So you're not the only one. I can tell you because I've had a lot of people talk to me about it. If you find these things frustrating, you're not the only one. What I would say though is if you find this helpful, that's great. That's fine as well. So you've got lots of reactions to these types of things. You can remind yourself that it's well-meaning and maybe that's enough. You can try and ignore it and maybe that's enough. You can say something. Sometimes people feel like they can say, oh, look, I've got my own ways of doing this. Do you mind, thanks for the advice, but, I'm good, thanks. So you can tell people and you can say something. One of the most helpful things, though, I think, is that you can surround yourself by helpful people. So work out the people who you find helpful and use those people to get support from. And then the other thing you can do, I guess, if this is something that is frustrating for you, is vent to the people who you know you can do that to. And that might be family and friends, or it might be a professional, because venting sometimes helps. Okay. So this is the other thing that sometimes people can find frustrating. Now, this is a particular one where I would say this is for some people, but maybe not for others. So just take this if it feels appropriate for you. But this is the pressure to be positive from other people around you. So what I see in my work is that for a lot of people, most people maybe, the lead up to diagnosis, particularly for this group, diagnosis, treatment, and living with a neuroendocrine tumour can be a roller coaster. And when I say a roller coaster, I guess I'm referring to an emotional roller coaster. And I guess a roller coaster has all different types of emotions in it. So it's very normal to experience emotions like anger and frustration and being annoyed and maybe times of sadness or deep sadness. Equally, it's pretty normal to experience feelings of things like relief or feelings of strength in this situation, or feelings or times of joy. But that is a roller coaster that often goes up and down. And what I would say is that it can be difficult for most people to stay positive all of the time. But often that is a response that we see in other people. So people around us often have a desire to be positive and a desire for other people to be positive. And that is a way of coping, I think, as well. So how do you communicate with someone when there's this pressure? It's a really tricky thing to do, I think. One thing that sometimes I talk about with people is trying to explain that situation, trying to explain about the many different types of emotions, and it's difficult to be positive all of the time. Maybe that will work. And you can guide people in what you need. So sometimes I think the pressure to be positive is because people don't know what to do. So if a patient is in a moment of distress, sometimes the people around them don't know how to cope with that, and they don't know what to do to help. And so telling someone to cheer up or it'll be okay, or you just need to be positive, is a way to kind of manage that situation for people. But maybe as patients, we can help by letting those people know what we need. And again, I guess surrounding yourself by people who are helpful can be another way to kind of manage that situation. The last speed bump that I want to talk about is monitors versus blunters. And I quite like to talk about this because people usually find it quite interesting. So there's been a fair amount of research about how people cope. And one of the things that has kind of come out of that is that there is two kind of groups of people. And I mean, it's a bit of a generalization. We're all on a continuum, but in general, two groups of people. And there's people who are monitors and there's people who are blunters. Now, monitors are people who like to have a lot of information and they like to talk a lot about what's happening. That's their style and that's how they cope. And actually, monitors cope better and they have less anxiety when they get more information and they're talking about things. So what I would say is that I kind of hope that most of the people in this room right now are monitors, because you're getting lots of information today and hopefully that's helping, coping. It might be, so blunters, that's the kind of other side of the coin, and blunters are people who they like to have the bare minimum. So they don't want to know a lot of information. They need to know the bare minimum, and that's what helps them cope. Actually, for them, too much information is unhelpful and can increase their anxiety. So if there are blunters in the room, they might need to be going for a bit of a walk occasionally. Or the other thing that often says is monitors might have dragged the blunters along. So just be aware of that. And the tricky thing with monitors as blunters is that I don't know if we pick to be a monitor and a blunter. I think we just turn out that way. I'm a blunter, by the way. So there's nothing wrong with either of these strategies. They just are ways of being. The thing is, though, that because we don't kind of choose who we are too much, you can end up in a family or a friend group where there's some monitors and some blunters, and you can get the situation where the monitor wants to talk about things all the time and get lots of information and wants to ask the doctor lots of questions in the appointment, and the blunter's sitting there going, oh no, don't tell me, I don't want to talk about it. And as you can imagine, that can cause quite a lot of tension in a relationship or in a friend circle. So what do we do about that? Like, that's tricky, isn't it? These things aren't easy. So I think one of the things you can do is have a think about that and acknowledge people's differences. And you manage it. I guess what we'd also say is that monitors need to find other monitors to talk to. So we don't always have to get the support from the same people. You know, we don't always have to rely on our partner to get all our support from. It can be quite good to have a few people in our circle and know who the people are that are good to talk to. It might be that you know that within your partnership there's a monitor and a blunter, and so you organise that with the doctor and you say, look, I really want lots of information, but Joe wants to step out for this bit, is that okay? You know, I guess you try and manage it the best you can, but you find also who you can talk to. I would say as well, though, that it's really important that blunters do get some information. There is a level of information that we all need. It's just that monitors like a lot more. Okay, so what about the doctors? So I think thinking about communication with doctors, particularly with neuroendocrine tumours, is that I think that for a lot of people with a neuroendocrine tumour, there's the potential that diagnosis has been delayed, and Philippa talked a little bit about the number of health professionals and the number of visits that people can have before they get to a diagnosis. And this can understandably, I think, affect our confidence in the medical system and in doctors. And I think although some of our doctors would potentially beg to differ, they aren't always the experts that you want them to be. And they don't always know how to handle that either. So, you know, it's quite a tricky thing sometimes communicating with doctors when you've got that history and you may have lost a little bit of confidence in the health system. Now, again, just a reminder, that's not everybody, but that might be some people. In our hospital system, we're very set up that you end up seeing a lot of different health professionals. So you turn up at an appointment and you've got Dr. Joe, and then you turn up at an appointment the next month and you've got Dr. Karen. And that can be really difficult for people. And appointments are nerve-wracking. Often people come with a lot of anxiety to appointments, and that's really understandable. They can be quite difficult. And when we're nervous, our fight or flight response happens, and it can be really hard to take in information and make sense of things. So there's quite a lot going on when you're trying to communicate with doctors. There's also a lot of information, isn't there? I mean, I was blown away by Philippa's talk that, you know, there's so much to take in. So I guess there can be some tips for that as well. They're probably not rocket science, and they're not, the be all and end all, but there's some ideas. So it's really important and okay to ask questions of health professionals. Don't feel like you can't do that. And it's okay to write notes in an appointment, and it's okay to ask doctors to write something down if you need them to. It's important to find a health professional that you trust, and I'm really aware that nurse specialists are one of the really good, consistent relationships that you can have with a health professional, or it might be someone from the Unicorn Foundation, but finding someone you trust is helpful. And telling the doctor how much information you like is also good. So if you think about that monitors and blunters stuff, doctors don't know whether you're a monitor or a blunter. They have no idea by looking at you. Unfortunately, monitors don't have black hair and blunters have blonde hair. So you have to tell them. So it's okay to say to the doctor, look, I'm the type of person that likes a lot of information, or I'm the type of person that just needs to know the bare minimum. Talk to them about that. And it's also okay to ask for another appointment. So if you find that you've had a lot of distress in your appointment and you haven't taken everything on board, it might be okay. I don't know your particular settings, but it might be okay to say, do you mind if we make another appointment to go over this again? Okay, so in summary, communication can be a challenge. It can be difficult for people. That's normal. It sounds simple, but it's not. Think about what works for you. That's the most important thing. Think about the type of person you are and what's going to work for you. Watch out for those speed bumps of advice giving, stories, pressure to be positive. And what was my last speed bump? Oh, monitors and blunters. And, you know, we don't always get it right. I don't get it always right. None of us do. So, you know, we have our own speed bumps along the way. But surround yourself by helpful people. And if you need to, talk it through with a professional. So that professional might be a psychologist and a social worker. I'm part of a Ministry of Health initiative, and we have social workers and psychologists who work all across the country. They're in every DHB. So there's always access to a psychosocial professional. There is also really good support, as you know, through the Unicorn Foundation New Zealand, and also the Cancer Society often has access to counsellors and psychologists in their areas.